Hola a todos, bienvenidos a Good Science, Ciencia, Cultura y Teología. Soy Cristian Jiménez, médico de profesión y cristiano por vocación. Hoy vamos a descubrir cómo algo tan cotidiano como la luz del sol puede transformar tu cerebro, tu salud y tu vida. Y lo haremos de la mano de un médico reconocido a nivel mundial, el Dr. Seheult. El Dr. Seheult es especialista en medicina interna, neumología, cuidados intensivos y medicina del sueño. Así que les dejo esta primera parte.
So I'm a board-certified internal medicine specialist. Then I did an extra 3 years of training here in the United States on pulmonary and critical care. So I deal with all of the issues that are related to the lungs and the critical care aspect. So if you are admitted to hospital and you're critically ill, you go to the intensive care unit, I'm the doctor that you see. So I'm putting in the lines, putting them on vasopressors, intubating them. I worked in the clinic this morning. So this is a story by a lady by the name of Amy Honmeyer. Her 15-year-old boy was diagnosed with lymphoblastic leukemia, went into the hospital, actually started chemotherapy for it. And so the treatment for blood cancer is chemotherapy, which he started. The side effect of chemotherapy is suppressing the immune system. And unfortunately, he didn't realize it, but he developed a fungus flesh-eating infection in his lung and went into the hospital in June of 2024. This is in Minnesota, tertiary care hospital. And he got worse and got worse and got worse to the point where the only way that they could control this infection was to actually remove his left lung, which they did. So this is a 15-year-old boy. He is without his left lung. He only has a right lung. And he starts to decline even after that. They do a CT scan, and it shows that now the infection has moved to his remaining right lung. They have a family conference. And as Amy is telling me this story, I could hear her choking up. She's telling me this on the phone. She's saying that he's 15, he's completely awake, he's completely alert. He knows everything that's going on around him. He's on a ventilator, like a machine that they use for sleep apnea. It's like a BiPAP machine that's breathing for him. It's not intubation, but it's on his mouth. And the doctors, have done everything they possibly can. And they say, look, he's getting worse. We can't take the right lung out. We can't put him on a heart-lung machine because there's no sort of destination to where he's going. We recommend not intubating him and making him what they call DNR, do not resuscitate. So they're like, wow, they were not expecting this coming. So they have a big conference. They call in help to, like, how do you explain to a 15-year-old boy that you're dying? And how is that going to feel? So they ask the doctors, how much time does he have? They say 2 days. So in this situation, they ask this boy, okay, you're going to die. What do you want to do with your life in the next 2 days? What do you want to do? And surprisingly, he says, I want to go outside. I just want to go outside. This guy grew up probably on a farm or something, and he spent his time outside. So he wants to go outside. So I don't know if you know this, but like if you're a nurse or you're a doctor and you've done everything you can and you're just completely horrified at the fact that this 15-year-old is going to die, and he has one request, you're going to move heaven and earth to fulfill that one request. And that's exactly what they do. They get this boy the hospital bed outside. He's on a BiPAP machine the respiratory therapists have put together. So this guy is outside. And they're not putting him outside to get better. This is his dying wish. They also use this thing called a Firefly. It's like a light device that they were using. I'll be honest, I don't know which did it. It's a light device that gives off light at different wavelengths. And they would use that for about 3 times a day for 5 minutes. This guy does not die. After the first day, his white count starts to come down. That's like a measure of the infection that's going on in the lung. And by the way, they do a CT scan of his lung before this all starts, and it's just the remaining lung on the right is just filled with infection. It's horrible. By the second day, the white count comes down even more. And by the way, they haven't changed any of the other treatment. By this point, he's been in for 6 weeks. He has not seen the light of day. And he's still getting the powerful antifungal medication, amphotericin B and posaconazole. All of these things are really high-powered drugs that just completely fight fungus, but it's not working. He's getting worse. But now he's out for the second day. The white count's coming down, which is good. That's a good sign. His oxygen requirement is coming down. That's a good sign. He's requiring less and less oxygen. By the time he gets to day 5, okay, we're already past 2 days. He's off the BiPAP. He's on regular just nasal cannula oxygen that you see people wearing on their nose. The doctors are scratching their head. They're like, we should get a CT scan to see what's going on. So Amy tells me that they get a CT scan of this guy, and they're in the room, and some even like swear under their breath, like they're completely amazed. Because on the CT scan, obviously the left lung is still gone, but the right lung, the disease is probably 60, 70% gone. And he's still alive. He goes home. There's no sign of the disease after treatment. And she just communicated with me to tell me that he just got his Make-A-Wish thing for his cancer. He's continuing treatment. And she just can't believe that he was literally 2 days away from dying. They changed nothing. They changed none of his treatments. The only thing that they did was they took him outside, and they were using this Firefly before inside, but they were using it more consistently when he got outside.
Maybe hospitals should be outside.
This is exactly what, okay, so if you wanted to know what my drive was, what it is, my purpose that I'm doing right now, I'm working at 3 different hospitals. And I'm trying to work in each of those 3 different hospitals to try to get patients outside. The biggest barrier that we have is staff taking those patients outside. That's the thing that's the hardest. But this is what we used to do, Stephen. This is what we used to, when we built hospitals at the turn of the century, we had hospital rooms where beds could be taken out onto the veranda and people could get sunlight. I would love to see a time where we could go back to that type of effect. There's studies that have been done. People in a 2-bed room, if you're the bed closer to the window, you get discharged from the hospital faster on average. So as a critical care intensivist, when I heard that there was this virus that was coming, they all told us that it was going to be people with respiratory illnesses, which I was certainly comfortable with. But that's not what it turned out to be. We certainly saw people with respiratory illnesses, but what we saw in the intensive care unit, the people that were dying around me were people with obesity, people with heart disease, people with kidney disease, people with dementia, people with chronic diseases. And it made me think, why was that the case? All of those things have one thing in common, and many other things too. But specifically, they're rooted in something called mitochondrial dysfunction. So let me unpack that for you. And this has to do with longevity. This has to do with aging. This is a huge topic that is now just emerging, and we're now finding more about this. So when I was in high school biology, when I was in college, we all learned about this little organelle in all of our cells, except for red blood cells, called the mitochondria. And I have to say it, what is the mitochondria? It's the powerhouse of the cell, right? So it's the thing that makes energy. What we didn't know at the time is that as we get older, the output from these batteries in our cells drops by about 70%.
Damn.
Can you imagine running your house on 70% less energy? Well, how fundamentally that would change. You could not run the microwave and the laundry at the same time.
And what does that look like in terms of symptoms?
Excellent question, because what it looks like is, depending on the cell type that we're talking about, that's going to have the issue. So if we're talking about the liver's going to get more fatty. If we're talking about the heart's going to become more congested. If we're talking about the brain, it's going to have more dementia. And so what's happening here is that as we get older, the batteries in our cells are not working the same way as they used to. Metabolism is slowing down. And so these are huge issues. And all of these diseases that I just talked about, all the ones that we saw in COVID, if you look in a lot of these diseases, they are rooted in mitochondrial dysfunction. So the question is why is that the case, and what can we do about it? So there was a paper that came out in 2019 that fundamentally changed the way I saw this. It was written by Russell Ryder, who is the executive editor of Melatonin Research. He's out of University of Texas, and Scott Zimmerman, who's a light engineer. And what they set forth was to show that basically sunlight is made up of so many different types of wavelengths. You've got ultraviolet on one end, which of course makes vitamin D. and it's very beneficial. It's the type of light from the sun that is very shortwave, but cannot penetrate very deeply. And so when the sun is shining, there's very short wavelengths, ultraviolet B, involved in vitamin D. But at the other end, there's this infrared light, which we'll talk about, or red light. It's very long wavelengths, and it can penetrate very, very deeply. That's very important because what we're talking about is the human body. And if the sun is going to have an effect on the human body, it's got to be more than just the skin. So that's exactly what this paper showed, is that basically infrared light from the sun is able to penetrate probably up to about 8 centimeters, according to Scott Zimmerman in this article. And it fundamentally interacts with specifically the mitochondria. So what these guys in this paper showed was that, and not just them, but reviewing the literature, is that the mitochondria makes its own cooling system. And that cooling system is melatonin. Now, you might be thinking, wait a minute, melatonin, isn't that the stuff that we take, that our brain makes right before we go to sleep? Yeah, it's absolutely correct. That's what happens. The problem is that this is not melatonin that's made in the brain. This is not melatonin that goes through the blood supply and goes through our blood and tells us it's time to go to sleep. This is melatonin that's made in the cell, in the mitochondria. And it's a powerful antioxidant that basically prevents the oxidative stress from occurring. What Scott Zimmerman and Russell Ryder showed and proposed in this was that basically the infrared radiation that's coming in to the body is able to stimulate and upregulate melatonin and a number of other factors that keep the mitochondria cool and can actually improve the energy output of the mitochondria. So this was actually mind-blowing to me. And I'll tell you why I resonated with this as a critical care physician, because there was 2 things that bothered me the most. Number 1, SARS-CoV-2 virus. When it comes into the body, it interacts with something called the ACE2 receptor. You may have heard about the ACE2 receptor. Okay, this is where the virus actually latches on to the cell and gets internalized. So what is this ACE2 receptor? Was this there for all of humanity just to be a receptor, or does it actually have a role? It turns out it actually has a role. And mind-blowingly, the ACE2 receptor is involved in mitigating oxidative stress.